Hello, everyone, and welcome. Our thinking point for today will be quite different, a deviation from our usual abstract concepts, because today I'll be talking about a rather concrete subject, which is about the brokenness of my country's, the Philippines healthcare system. Now, this is a topic which has actually long been recognized in my country. It's a topic which sometimes becomes apparent, becomes more obvious, especially in times of crisis. But I don't think it's a topic which is talked about enough, especially by doctors. Well, I'm a medical doctor by training and profession, and I'd like to be one more person, just one more person to talk about this subject. To start, I'd like to share with you two examples of why I think and why I say that the Philippine healthcare system is not exactly in good shape. Last year, when I was still in training, I had a patient who had a suspicious breast mass. This patient was a charity patient because she could barely make ends meet. And she was seeking treatment at one of the larger tertiary government hospitals in the country. Unfortunately, as is the case with most public government hospitals in the Philippines, the wait times can be excruciatingly long. So she had a suspicious breast mass. And if I recall correctly, she had to wait at least 5 months to get a breast ultrasound and a breast mammography done. When the 5 months had elapsed and finally she was able to do those tests, and the findings were indeed suspicious for a malignancy, she had to wait another 5 months for a biopsy to be done. Eventually, the biopsy was done in the same hospital, and quite unsurprisingly, the findings were indeed cancer. Now, for a cancer patient, there's a series of workups that need to be done before we jump into treatment right away. So more tests, which took more and more months. Eventually, as the months went by, the finding was that the malignancy, the cancer, had unfortunately already spread. It had metastasized. And our treatment approach for cancer which has already spread, which has already metastasized, is very different than what our approach would be if the cancer was just confined to its original location, meaning it's just a localized cancer. And up to this day, I can't help but wonder if the excruciatingly long waiting time had an effect in permitting the cancer to have such a long period of time to metastasize. If the time period was shorter, if the waiting times were shorter, could we have caught the cancer earlier? It's a question which up to this day continues to boggle my mind. My second example is from a recent patient. This is actually a friend of one of my family's business associates. This friend had an emergency. Eventually, the diagnosis was acute appendicitis, which is a medical emergency. Again, this person did not have enough funds. He wasn't exactly well-to-do. Again, barely making ends meet. And after he experienced severe abdominal pain, accompanied by nausea and vomiting. Nausea is the urge to vomit. He was eventually rushed to the hospital nearest his home, which was a posh private hospital in Taguig. Eventually, tests were done, diagnostics were done, and the suspicion was AP, acute appendicitis indeed. But the friend and his family were worried about the elephant in the room. The elephant in the room being, of course, the cost, the expenses, which they would eventually have to pay if they stayed in that hospital. And so they asked the emergency department for the running bill, which took them by surprise. They decided that they definitely would not be able to afford the running bill alone, which was not even the final bill when eventually the surgery would take place. And so what happened was they requested a THOC. A THOC means a transfer to another hospital of choice. But at this point, one would think if our patient did have enough choice to begin with. But eventually a THOC was done to a government hospital, also in the same city, of course. When the patient reached that hospital, again, just like in our first example, the waiting line was awful. According to our friend, according to the patient, the healthcare staff, probably because they were more overworked, they were more understaffed, they were not exactly pleasant. And eventually, what happened was the patient eventually went into the operating room, and the finding was that the appendicitis had already ruptured. It was a ruptured acute appendicitis. Thank God that this patient eventually recovered sufficiently well. The surgery was completed thankfully successfully. But again, in hindsight, one would wonder whether the unnecessary waiting and long periods of time which elapsed since the beginning of the symptoms played a role in the eventual rupture of the appendicitis. Had the patient been able to afford the original institution, would the appendix have ruptured in the first place? So just some two concrete examples to set the tone. And for those of the viewers here who are not from my country, it's a well-known fact here that our healthcare system is pretty much run by out-of-pocket expenses, OOP, out-of-pocket expenses. We do have a national health insurance covering the country's citizens. It's called PhilHealth, the Philippine Health Insurance Corporation, but usually the coverage of PhilHealth for medical consultations, diagnostics, and treatment is almost always not enough. It will not cover the entirety of the expenses. For example, if your total medical bill is 50,000, usually only half of that will be covered by PhilHealth. The rest will not be covered. And you have to shell out. You have to do OOP so that you'll be able to pay the entirety of the medical cost. And that is why, albeit satirizingly, many patients and doctors even comment that the healthcare system in this country is only for the rich, only for those who have. If you want quality healthcare in the country, then you have to be prepared to shell out for it, which is probably the case for other countries as well, if I am correct. If you don't have the money, to put it bluntly, you'll have to put up with long waiting times, with rather unpleasant staff and environments. And it's a recognized fact here in my country, but I think it can never be talked enough. And certainly, I think more and more of my colleagues, more and more of my doctors have to step up and talk about the elephant in the room. Thank you very much for watching this short video. I'll definitely see you in the next. We'll think about what our next topic will be. But again, thank you and stay safe, everyone.